see you.
Good to see you.
See you guys.
Okay, so this is Senate Health and Welfare. We're back live on January 16th. And we have the sponsor of H237. It's like deja vu all over again. But it's a good deja vu all over again. So thank you for being here, Representative McClellan. Introduce yourself for the record and give us kind of the background for why we have this bill. Also.
Representative Topper McFarland, for the record. This bill came about because several psychologists that work in my district approached me and said, she's gone through the bill. So what they were saying is, we're finding that when we're dealing with somebody with mental health problems, they can't, if a prescription for some kind of a drug is needed, they can't do it. And they have to wait to get a psychiatrist to see the person, bring them up to date, and whether the psychiatrist is the only one that can provide the prescription. So we all know that there's a shortage of psychiatrists in the state of Vermont. And this would help people with mental health issues immensely, because they're dealing with the psychiatrist, the psychologist that is working with them. They would be able to provide that prescription if it was needed. Now, before this can happen, these psychologists need to take certain courses so they understand the ramifications of using a particular drug. And they were all in agreement with that. We need to do that graduate work before we prescribe. So that basically is the reason I introduced the bill. Shortage of psychiatrists helping individuals with mental health problems to get services as quickly as possible.
Questions? No, that's good. So then we have Rick Burnett has contacted us about testifying. I think he must have testified in your committee as well. That's a PhD psychologist. Yeah. But, yeah. If you have any suggestions for us for testimony, have your committee assistant send them in if you can. That'd be great.
Okay, well, I could probably get one of those people that talk to me
To testify?
to testify.
Sure, that'd be great.
They'd be a good witness for you because they do it every day.
Yeah, yeah, good. That'd be great. Okay.
Yeah, okay.
Thank you, Thompson.
Okay,
Thank you.
all right. When do you need the person in here?
ASAP.
Okay.
Well, no.
Just like me.
No, we will, I don't know, I think we may have it scheduled coming up next week, or it'll be next week after, we'll be working on this.
Okay, so I'll have to.
Yeah, please, yeah.
All right, good.
Don't,
Thank you very much, and thanks for taking it up.
okay, I told you.
It's a good bill.
Yeah.
Thank you.
Thank you. Thank you, Katie.
Thank you.
Yeah, no problem.
All right,
Madam Chair.
yes,
We also have a psychiatrist.
oh, yeah.
So we hear kind of both sides.
Yeah, so what I'm thinking about, so what I do is as I'm listening to this and thinking about it, and I'll look at their list of testimony. And we have a psychiatrist, a psychologist who sent in a list, and VMS, of the Vermont Med Society, is one to be in. So we have the Office of Professional Regulation. We got a whole list of people. And then we just narrow it, so we got the basic information.
Thank you.
Yes,
Hello again.
all right. So, welcome back.
Thank you. Let's see, still Katie McDonough, Office of Legislative Counsel, and I will jump back to S206. Is that
That's where we are.
okay?
Yep.
Oh, that's too bad. I guess when I left the room, I lost my connection to Zoom. Oh, true. So while I'm pulling this up, I can refresh your memory that we were looking at S206, which relates to early childhood educators. This was a licensure program, and it is licensure of the person, the actual human provider, versus the childcare program, which is licensed by DCF. This created 4 new categories, and it doesn't take effect immediately. The bill builds in some time for the board to be in place and for rules to be adopted. Oh, here we go. Getting close now.
It's Friday. It's in the air. TD.
Okay. Here is the document. So I already gave you sort of a high level overview of what's in the bill, just to sort of scroll through and give you some familiarity with how it's structured. Here we go. So first in Title III, we have a list of all of the professions, that are administered by OPR or governed by OPR. And so it's a big long list, and we're adding number 55, early childhood educators, to the list in section 1. In section 2, there is a new chapter being created, early childhood educators. So this, a chapter is being created here. The chapter in this section 2 appears a little out of order because this section 2 is what goes into effect first, the setting up of the board. And then in section 3, we sort of backfill the chapter with what will be in effect at a later date. So we have the creation of the Board of Early Childhood Educators. This subsection has to do with the makeup of the board. And then at the top of page 3, we have how the vacancies on the board are filled. The next section, 6212, is the procedures of the board when they meet, how they elect a chair, what is a quorum, how does voting happen. 6213, yes.
So I'm just wondering, there's no connection here with Morgan Crossman's group. Anyway,
With regard to the board,
yeah.
no.
It might be good to hear from them.
Yeah.
For futures.
What for organization, building bright futures, good, great. Yeah, so that would be helpful.
Okay. 6213, this is the powers and duties of the board. So they're responsible for adopting rules to oversee the licensure. They would provide general information to applicants for licensure. They would explain appeal procedures to licensees and applicants, as well as complaint processes to the public. The board would be responsible for using administrative and legal services provided by OPR. And the board may conduct hearings and exercise its authority as provided under 3 VSA Chapter 5. Section 3 amends the chapter that you've just created in Section 2, but you'll see now we're putting in subchapters and we're starting with 6201. So this is language that takes effect when the actual licensure takes effect. So Section 2 is setting up the program. Section 3 is starting to implement the program. So we have definitions, including who is an early childhood educator. I know we're doing high level, but
Yeah.
it feels important. Don't do it.
No.
Okay, I just can't help myself. It means an individual providing care and educational instruction to children from birth through 8 years of age in a program regulated by the CDD, meaning the division within the Department for Children and Families, including planning and implementing intentional, developmentally appropriate learning experiences that promote the physical health and social, emotional, linguistic, and cognitive growth of children, establishing and maintaining a safe, caring, inclusive, and healthy learning environment, observing, document, and assessing children's learning development, developing reciprocal, culturally responsive relationships with families and communities, and engaging in reflective practice and continuous learning. So that's what we mean by early childhood educator generally. And then we start getting into definitions where we're calling out and defining each of the 4 categories that are being created. So there's an early childhood educator 1, which is a person who practices as an assistant educator in a program under the supervision of an early childhood educator 2 or 3, or a teacher who's licensed by AOE.
So just want to flag the term educator as something about which there is angst between educators and childcare providers. So the word educator, so what other word is there that could conceivably be there and should it be? That, I guess there's been a huge discussion about that, and I just want everyone to know, be prepared for that discussion.
There's a lot of conversation in GovOps about what the right terminology is.
Yeah.
Early childhood educator 2 is a person who practices as a lead or primary educator in a program. They would supervise the ECE 1 and receive guidance from the ECE 3.
That's right.
The early childhood educator 3 practices as the lead or primary educator in a program. They supervise the ECE 1 and provide guidance to the ECE 2. And then there's the family childcare provider, who is the individual who's providing developmentally appropriate care, education, protection, and supervision of children from birth through 8 years of age, and is authorized by DCF to operate a family childcare home. So those are the 4 categories: ECE 1, 2, and 3, and then the family childcare provider. I'm going to skip over these. So we have some prohibitions that an individual can't hold themselves out as an early childhood educator unless they have a license, or they're exempt. And we have a section on exemptions. And the individual can't use in connection with their name the term early childhood educator, again, unless they have a license or they're exempt. So here is our section of exemptions, which I think is important because there's been a lot of conversation about, again, the term educator and who is being captured by this license. So this does not apply to a teacher who's licensed under Title 16, which is the education title. When they have endorsements in early childhood education, early childhood special education, or elementary education. Similarly, the chapter does not apply to individuals who provide care in an after-school childcare program that's regulated by the Department for Children and Families, or any other childcare program that is exempt from regulation by DCF. So I guess I should just pause and say that in DCF's statutes and rules, there are some providers who are offering child care services that do not need a license from DCF. They're exempt from DCF. For example, I think if a family child care provider is watching their own child plus children from 2 other families, they don't need a license. I think I have that right, that it's 2 other families. Similarly, if it's a child care program that's associated with child care services during like a religious service, those don't receive a license from DCF. Or I want to say the ski resorts, they provide childcare services. That's not a licensed childcare facility under DCF. So when they're saying if it's exempt from regulation by DCF, that's what it means. Most programs that are providing care in a center or home are regulated by DCF. This doesn't alter the requirements of the universal pre-K. And this is not construed to limit or restrict in any manner the right of a practitioner of another profession or occupation from carrying on in the usual manner and functions incidental to that profession or occupation. So we are now creating subchapter 2, which is where the board will go we've already seen all the language related to the board in section 2. That's why we have these ellipses, because that is not changed. We're just holding space and saying that is as you've already seen it. And on page 8, subchapter 3, this is where we get into the actual licensure requirements. So to be eligible for licensure, the applicant has to have attained the age of majority, achieved a high school diploma, a GED, or an approved equivalent credential, and completed field experience in early childhood education as required by rule. And then subsection B takes each of the 4 provider types in turn and outlines the specific requirements. I won't go through that now. But they're a little bit different, as you would imagine, for each of the 4 types. Important to note, and we'll dive into this more closely, for the family childcare provider, the person has to be in good standing with the division as of January 1, 2029, and the board shall not accept applications after January 1, 2029, meaning that everybody who is practicing prior to January 1, 2029 as a family childcare provider can obtain that as a license type. After that, that license type would go away and a person would have to fall into the ECE 1, 2, or 3 categories. So it sort of grandfathers in the folks who are currently practicing as a family child care home provider. But for future folks coming into the field, they'd have to be licensed under one of the other 3 categories. I'm gonna skip over this for now. There's language about how to renew a license every 2 years. There's a renewal process and a required fee. There's language that talks about if your license has lapsed, how it could be reinstated. But that the license of a family childcare provider would not be renewed if there's a lapse of 2 or more years. Let's see. Then we have language in 6223 about fees. So we're setting up a fee structure for the 4 licensure types. We have language about unprofessional conduct, which is conduct prohibited in Title III or by other statutes relating to early childhood education, whether that conduct is by a licensee or an applicant. The conduct that results in a licensee, applicant, or individual being placed on the Child Protection Registry is prohibited conduct. Conduct not in accordance with the professional standards of the early childhood educators published by the National Association of Education of Young Children. So those prohibited conduct. This is where we have language about variances. So for early childhood educator 2 or 3, there are transitional licenses. They would be available for 8 years after the passage of this section, which would give individuals time to come into compliance with any educational requirements or experiential requirements that they're not up to date on to achieve these licensure types. There are required disclosures by licensees. So an early childhood educator licensed in this chapter is to post and provide current and prospective families the following information. All available license types. So they would have to post and provide to families what are the different license types that are regulated by OPR, a description of OPR's regulatory authority in the programs regulated by CDD and how to make complaints. Also a description of AOE's regulatory authority over teachers for providing pre-K services, and a description of CDD's regulatory authority over regulated childcare programs and how to make complaints. So basically what this is saying is that there are different professionals and they're regulated in different ways. There are some that are going to be in the school or the program that are regulated by OPR. There are teachers who are licensed by under Title 16 to provide universal pre-K. There is
I'm sorry, that's the AOE, right?
yeah, what did I
No, you're right. I'm on Title 16, but
Title 16,
and then
yes.
Agency of Education.
Yes. And so this is saying that there has to be notice to provide a parent or guardian with information about how to contact and make a complaint about different folks, depending on what their licensure is. So as we said, the transitional license is only available for 8 years, so this language repeals that provision after 8 years. Section 5 is, this is the appropriation language. So we have a appropriation happening in fiscal year 27, and new positions created. So in 27, a new position for the Vermont Board of Early Childhood Educators, that's the executive director, and a full-time exempt staff attorney. And the amount for that is $262 appropriated from the general fund. In subsection B, there is also language about the creation of 3 new positions and an appropriation, but you'll see, whereas in subsection A, the appropriation is going out, it's affirmative language that the appropriation is happening. In subsection B, we're leading in with, it is the intent of the General Assembly to do this. So as not to bind future legislatures to an appropriation made by this legislature. So it's the intent in fiscal year 28 to create a full-time classified licensing staff, a full-time classified enforcement staff, and a full-time classified administrative staff position. And the appropriation for that would be $628,867. And then we also have this intent language with regard to fiscal year 28, that 1.4 million be distributed from the Child Care Financial Assistance Program to OPR for the initial licensure and application fees and licensure renewal fees for all early childhood educators practicing in programs regulated by CDD. So meaning that CCFAP money would be used for the initial license fees for these professionals. And then, as you can imagine, the effective dates are tiered because we have the board taking effect before everything else. And that brings us to the end of the bill. The actual licensure piece would start on July 1/28.
It's a big bill.
It's a big bill. There's
It's a
a lot.
very
in
big
there.
bill, and I know that there are a number of folks who are very enthusiastic about it. There are some folks who have concerns, in particular with respect to what childcare providers have to do, individuals have to do, and then the term educator. I just wrote down a whole bunch of different terms we could talk about. I'm sure they've been through all of them, and this is going to be this will be a good bill to understand next steps for that profession. It is an important profession. Look at it. Any questions, committee? Katie? OPR will be in. We'll have different folks in who are currently working in the field. If we can get them in, we'll have Building Bright Futures in with Morgan Crossman. I talked with her the other day about it. I'll have to have it, we'll talk again. And then we have CDD, we have AOE, we have Let's Grow Kids who've been working on this, even though they're disappearing. But Allie Richards has indicated an interest in testifying on it. So we have a long list of folks.
I just do have a question, and
Go ahead.
if you don't mind, Katie, was there ever any talk of having a certification be sort of another tier in the Agency of Education? I can't remember if we ever talked about that.
I'm not recalling it coming up in Senate GovOps last year. I don't know if it's something that OPR considered.
Yeah, I know it's helpful to have it in here, just given our experience with childcare. So that's a good question to ask when OPR comes in, and also when others, everyone.
I do sort of tangential, but not the big childcare bill, but the one we did the preceding year that asked for a lot of reports. There's language, I think in two places, about asking AOE and DCF to work together.
Oh,
to
yes. there was.
elevate the status of early childhood education within the Agency of Education.
Okay.
So that is sort of related to your question, and I can't recall when those reports were due. But if you're interested, I can dig around a little and see what I can find.
Yeah, I mean, there's always been that tension. Yeah, if we can get that, we should have that as a baseline
Yeah.
for us. I asked to have some of those things put into that bill because of the tension between AOE and DCF. And the oversight regulation, and now OPR has stepped in, so
Right.
it's another world. Okay,
Okay, we'll take that out.
thank you for that.
Yeah.
Any other questions?
Why the different classifications? I don't see anything in the bill that, unless I missed it, that defines what their requirements are. But
What are they doing?
yeah, why do you have to have a different classification? I didn't see where that applies.
Yeah, I moved over it too quickly. I'm thinking that
We'll get it.
likely you're getting a more in-depth walkthrough at the
I
point,
can
but
wait for
Well, it's okay, no, answer it now.
so this lays out sort of the educational and experiential requirements for
Right.
each of
that
the
is
three.
all. Yeah,
And then in the definition section, when it lays out each provider type, it tells the type of responsibility they have within a classroom. So an EC3 would be somebody who is a lead teacher, and they would be supervising the ECE 1 and 2. The ECE 1, for example, says plays an assistant role within the classroom. So doesn't mean that they can't be, fleshed out more or improved upon, but the definitions is where it lays out
just trying to think of it
Responsibility.
in terms of
Yeah.
the so-called daycare facility and center and how these different roles fit
Mhm.
into that.
Yeah, that's a really good question, because when you think about the daycare facility and people moving from one responsibility to another, so do they have to stop and say, well, that's not part of my license? I don't
Right,
know.
that's what I was trying to figure out how that
Yeah.
fits together.
I'm sure, well, just one thing that, been dealing with here for a little while, up in at least our neck of the woods, is how hard it is to get actual daycares. And I'm just gonna say that I will have some concerns about if this restricts in any way, any manner, new people trying to provide that service. I'm not saying it's not a wonderful thing, it's a great thing. I'm just telling you, there's a real need for them up where I am. So,
Good question. This is a fundamental question.
Yeah.
Yeah,
I think that also leads to cost, this is going to increase cost of daycare, and so, which is already very affordable for many families, so availability and cost, I think, are two things we have to consider.
I figured we'd dig into that later.
You know,
so a lot of
We have heard testimony about those things already, but yeah.
it'll
Yeah.
come. You
Yeah.
get it. If you have people who you would like to testify, like Calista know, and as we go through the list, we'll try to bring in some of those, sometimes we get more than we can handle, but. Okay. Any other questions for Katie on this one? So it's a little complicated.
There's a lot in this bill.
Yeah.
There's so many, pieces to discuss, having DCF in and looking at numbers of where there are providers and where there are gaps in services. What is the right terminology? What is the right education level? And what is sort of the right lever for grandfathering people in for who are currently practicing in the field? So yes, there's a lot to discuss here.
Good, we're gonna keep you busy.
You will.
It's good. Great. So, we have a few minutes here and we have guests in the room. with your name tags on, and I'm wondering if you would introduce yourselves and say why you're here and who you represent. So we'll start with you, Victor.
Hi, I'm Elena Bourne. I'm here with the Snelling Center for the Early Childhood Leadership Institute. I'm currently the director on a program in Jericho and live in Grand Isle. So interest in both areas, but
I'm Lindsay Shell. I work at Sharon Elementary School as preschool director and preschool teacher. So I was licensed through the AOE, but I still operate under CDD because they overlap in a public school. And I'm also with Snelling Center. Yeah.
Anyone else?
I'm Stephanie Slayton. I'm the executive director of the Family Place in Norwich, and we are a parent-child center, but we also have a small early childhood education. You should know which one. Yes, we should.
My name is Shannon Edmonds Folsom, and I actually came because I knew Senator Morley was going to hear it. He's my senator. I live in Newport City, and I am the child care manager for JP Resorts. So I'm very interested in all of this conversation. And very briefly, yes, ski industry childcare licenses are licensed.
Oh, they are.
Yes,
Okay.
I have more information if you're interested.
Excellent. Thank you.
Okay, so listen, this is sort of serendipity, isn't it?
This is fantastic.
I have, so did one of you contact me?
I did.
You did. I thought it was you. I know you work in Jericho and you live in Grand Isle.
Mhm.
But so what would be really helpful is if you, as you listen and learn about this bill, to have one or more of you come in and testify on the bill, your perspective. So take some time to look at it and it could bring us some help.
Awesome.
Would you do that?
Yeah,
Absolutely, for sure.
Wonderful.
we're all very passionate about it. That's why we wanted to be here at this meeting.
If you do that, remind Callista, you'll send a note into Callista, our assistant. And it's right on our webpage. And then let her know that you were here for this, and then we'll try to keep you all here on the same day. I think it's fun that we can get into a conversation. It's great. Thank you for being here.
Yeah.
Thank you.
And good luck with your
Considering.
Snelling Center work. Thank you. Very good what they're doing. Okay. Good. Well, I can see a lot of knowledge. I felt maybe I've opened Pandora's box. And that's okay. Okay, good.
We're all very nice.
I know. Oh, I know it. Okay. Anything else we need to know, Katie, on this one?
No,
No.
I'm wondering if you want to also cover the autopsy reports today.
Yeah, we've got two other bills, and Senator Hardy is actually the lead sponsor in both. Is she available, Melissa? Did you get a word back that she can do?
She's still online.
At 11?
Yes.
Okay, let's go offline.
Okay.
We'll come back at 11, and then we're gonna do, they're both pretty short, right?
I only have one of them.
You have to